So just introducing myself, my name's Luke Woodham. I'm the acting head of the e-learning team at St George's University of London. And I've been working with Professor Kate Tatton-Brown, my colleague here, for a number of years on a range of different initiatives, MOOC courses. Kate wears many hats. Probably better off, she's a clinical geneticist, I know those words, but she's probably better off explaining herself what her various expertise are. But she's been basically a pioneer working with us on developing MOOCs within St George's, and we're going to talk to you about a couple of examples of work that we've been doing that illustrate some of these opportunities and challenges for developing such things for healthcare professionals. So I want to start off just really mentioning what online teaching means at St George's to us, because we, like all of you, we do a great deal of online teaching. We have a huge range of tools that are in use. Primarily, at the front line, we have our virtual learning environment, which is Canvas at St George's. We used to be on Moodle, and we transitioned a couple of years ago to Canvas. We have Panopto, which is our lecture capture tool, but we have a whole host of other tools besides. We've recently started an audit of the educational technology tools that we use, and we're sort of whittling it down to 20 kind of key tools, down from about 70 that I use peripherally. So there's a lot going on. And most of that is used primarily in delivering blended face-to-face teaching. So it's really augmenting our sort of traditional approaches to teaching, delivering to undergrad and postgraduate students in classroom sessions, using the VLE to provide supplementary materials, using technology within those sessions in a blended capacity. And we do a variety of things like online problem-based learning, which is something that I've been heavily involved in, using virtual patients and things like that. But what we've been increasingly looking at is an increased demand for providing online-only training. Now, particularly in what we're going to be talking about in terms of medicine and healthcare trainees and professionals. There's a huge demand for this, and I think this week and over the next few months, we're going to see part of why that is, an increasing demand for online training at various sites. Within the healthcare professions, one of the key things that we're looking to do, there's the Topol review came out early last year in February, and this was talking about the needs for the healthcare workforce to be trained to deliver the digital future. There's a huge range of technologies coming up, being more widely used, and the healthcare workforce has to be prepared and trained to use those. Genomics, which Kate will talk about, is one of those key technologies that, and that developing those skills within the existing workforce is essential. And online training is going to be a key part of that. We've been taking that approach, looking at our MOOCs that we've been offering since 2015. These figures are slightly out of date, but we've been working with Futurelearn since 2015. I think our courses, mostly aimed at healthcare professionals in some capacity. We've had around 140,000 joiners in total, and about 75,000 learners now. We've also had CPD approval from 4 Royal Colleges, and Kate was one of the drivers of that in the first instance, getting accreditation from Royal Colleges for her genomics courses. And that's essential for healthcare professionals who have to have accredited CPD for their development and have their targets each year, similarly to as Mary described before. So we've created a number of courses, 3 genomics courses. I will let Kate talk to you more about those. We have 4 other courses that are specifically targeting areas of healthcare, healthcare training primarily for professionals, looking at developing clinical empathy, organ donation and non-invasive prenatal testing are courses that we developed that go alongside prospective or or actual changes in legislation that dictate the sort of healthcare provision that is being provided to patients. ECG assessment has been a very popular course that we've provided. We have some other courses that are more for specific areas. They might be for trainees or non-healthcare settings, education, so virtual scenarios and preparing our medical students for health electives. That one's addressing a particular need in the amongst the student population, and we developed that in collaboration with King's College London. And we also have two other courses that that we'll also talk about: global health governance, part of an MSc in global health, and design thinking, which Kate is particularly going to mention. And these courses really fall into one of three categories. There's really only one course that is specifically just for our students. That is the course on preparing for an international health elective. So that's really for medical students that are about to engage in electives. A whole host of our other courses are really aimed at targeting both university students, undergraduate, postgraduate, and healthcare professionals. And where MOOCs rely on social discussion on the Futurelearn platform, there are advantages for these for our undergraduate learners, that they get to learn alongside global learners that are actively engaged in the profession and at various different levels of training. And there are some courses that really are targeting the professional workforce, whether that be in healthcare or otherwise. So those for education, the course on innovation, and also non-invasive prenatal testing, which was primarily aimed with midwives in mind. So I'm going to hand over to Kate in a moment, who's going to talk about two particular approaches: the design thinking course and the 3 Genomics MOOCs that she has worked on as exemplars of two different approaches to credit-bearing modules. So Kate, if I can pass over to you.
Thank you, Luke. I'm going to start by talking about the design thinking course we've done. And the reason why we've chosen these two as exemplars is that the design thinking course is very much a blended learning approach to micro-credentialing, whereas the Genomics MOOCs are entirely online. And so that is an online solution to micro-credentialing. And so I'm going to just dive into those in a bit more detail. So for those of you who don't know what design thinking is, this is a way for individuals to approach those gnarly problems that occur in everyday life. And this is particularly important in healthcare, which is increasingly under-resourced and overstretched. Now, we did these slides about 3 to 4 weeks ago. It is hugely relevant to what is going on at the moment, as the NHS is really, really being stretched to its absolute limit. So if we go to the next slide, Luke. The idea behind design thinking is this double diamond approach, where you have a problem which through divergent thinking, you identify what those issues are. And that's through interviewing stakeholders and really identifying that list. Then you define those issues in convergent thinking. You decide which solutions you're going to go with, again, in collaboration with stakeholders, and the best ways of approaching that particular problem you want to tackle, which is, again, your convergent thinking as you bring together a plan to tackle that problem. So if we go to the next slide. So this is something that we are really keen on developing at St George's. Luke presented it very much as a course for the healthcare workforce, and that is actually how it's been presented at the moment. But in time, we'd really like to embed this across the board in undergraduate and postgraduate courses. So we ran the course initially as a 2-day face-to-face course in December last year. And as we were running that course, we knew that we wanted to put it online. So we developed the lectures in order to put it online. We did interviews with people that were coming to give talks and with people that were experiencing the course that we knew that we'd want to put onto that MOOC platform. So we then transferred it to a MOOC, and it has run a couple of times now as a 2-week MOOC. And we have recently had it ratified as a blended learning 15-credit module. If we go to the next slide, Luke. And this 15-credit module is now available as this 2-week MOOC. And this MOOC as all MOOCs are, is available globally and really acts as a funnel, bringing people into that 2-day face-to-face course. That was meant to be running in springtime, but we've had to, we're postponing that just a bit later in the year now, given the coronavirus. But so you have this 2-week online MOOC going to a 2-day face-to-face course, at the end of which you have an assessment, which actually is a presentation in the situation that's created problem solving. So that is our 15 credit module as a blended learning approach. And if Luke, if we could please go to the next slide. So that's design thinking. And I'm now just going to change tack to give you another example of microcredentialing within St. George's and think about what is very close to my heart, which is genomic medicine. So as Luke, in his very kind introduction at the beginning, I am a consultant in clinical genetics, as well as having an educational hat and a research hat. And so if we go to the next slide, I live and breathe genomics on a daily basis. And in my 20 years since I've been in genomics, I've seen enormous changes. And so this slide shows where we were when I started 20 years ago, which was the Pac-Man era. And at that stage, we were really sequencing one gene at a time. And each time we sequenced the gene, that would take about 6 months and cost about £1,000 to read that whole gene. And that is really exemplified how laborious that is by the Human Genome Project. And the Human Genome Project took 10 years to complete and cost many billions of dollars to read those 20,000 genes. But we've now moved to an era defined by something called the next generation sequencing technologies, which are mind-blowing technologies. And this is your Grand Theft Auto era. And so now these technologies allow us to sequence all 20,000 genes in about 3 days and at a cost of less than £1,000 per genome. So that is transforming healthcare. So suddenly genomic data has gone from this really quite expensive, inaccessible resource to something that is very, very much accessible. And so it increasingly be integrated across healthcare. And we're now routinely using genomics to diagnose rare disease. Increasingly, we're using genomics to provide personalized medicine. So really to treat individual disease based upon their genome. And in particular, the oncology world is really spearheading that. And the hope is that in the future, we'll be using genomic data to prevent disease. So by reading your genome, you'll have an idea of what diseases you're particularly at risk for. So if we go to the next slide. So given this tsunami of genomic data that is really hitting the workforce now, we realised that it was vital that we provide some educational tools for them. And many of our consultants, they come from the Mendel's Peas world of sitting in a lecture theatre and slightly nodding off in genetic lectures. So we really needed to upskill the healthcare workforce very, very quickly, but in as an engaging way as possible. So that led to the development of our first MOOC, which is a level 6 MOOC on the fundamental principles of genomics. And that's the genomics era, the future of genetics in medicine. So that's 5 weeks. And that really is a journey through genomics, presenting those basic principles through to how things are changing, really how they apply to clinical practice. And then we end with communication skills and ethics. And having produced that MOOC, which we had amazing feedback from and has reached about 50,000 learners worldwide, and has the discussions that underpin it are so interesting because you're getting that global perspective. We then thought that actually there was a real place for some postgraduate learning, and we developed these 2 level 7 postgraduate MOOCs in genomics. So if we go to the next slide, Luke. So I'm just going to drill down into those in a bit more detail. So the level 6 MOOC is used at St. George's as an entry level learning for the Health Education England funded MSc Diploma and Certificate in Genomic Medicine, and actually is now used on a national level as to entry to that MSc. If we go to the next slide. The Genomic Technologies and Clinical Diagnostics MOOCs, so they're the postgraduate level 7 MOOCs, were initially developed to produce learning for the PG Cert ICAG, which is a certificate in the interpretation and clinical application of genomic data, which we developed for clinical genetics trainees specifically. So that's an education and training program, but this has an entirely online module for that. And we also now use those MOOCs for an MRes in translational medicine. If we go to the next slide. And what is really, I find really interesting space, and the nut that we're currently cracking, is that we have now developed an online level 7 assessment. And that is really, really difficult. As educationalists in the room, you will know that actually developing an assessment that can be scaled up, so you need automatic marking, but really pushes the learner to that level 7 space, so it needs to be a bit more than an MCQ, is really, really difficult. And very few people have actually cracked that nut yet. We're hoping we might have done, and we have delivered this assessment online, but within the confines of a computer room to the MRes translational medicine students. And it's easier, I think, in genomics because it's very data heavy. So you can really focus that assessment on evaluating this really complex data. And we found it very discriminatory in the twice that we've run this assessment, really spreading students from distinction right down to fail. So it was a successful assessment and was an automated assessment. However, the next step is to move that assessment so it is online but on a global stage, and that has different challenges. So when you have a group of students doing an online assessment in a room, you can invigilate and you can make sure that you've verified identity and you have proper invigilating going on. When it goes on to that global stage, we then have to think about online proctoring, and so that is our next nut to crack with that, but we hope to be doing that towards the end of the year. And I think that's, if we go to the next slide, yes, back to you then, Luke.
So yeah, really just bringing this back in summary, I mean, I think what we've identified at St George's is there's a very compelling need to support distance learning to meet healthcare professionals. You know, it's the direction of travel for postgraduate education. Many of our courses are trying to prepare healthcare professionals for this work, trying to supplement their training and help them there. So we are looking at finding a way to take the online tools and to reach those professional learners to a much greater extent than we ever have before, and to use the flexibility and scalability that these tools have to allow them to fit this training in and their increased need for training with their huge commitments that they have. So I think the big challenge that we identify is that there's a need to recognize the value of the online education, and I think there's still some work to do on this, and how we recognize online education as not just an alternative, but a very good alternative to face-to-face teaching, and how we can adapt current systems and procedures to fit online delivery. And these are some of the things we've been trying from the different angles that Kate describes to approach within the work we do at St George's.